I'm Brett Houston and I'm a Future 40 winner. So I'm a hematologist at Cancer Care, and I specialize in blood cancers. So I primarily see patients with myelodysplastic syndrome and acute leukemia. Hematology is the study of blood. So there's a lot of different elements to hematology. Some of them are the evaluation of low blood counts or high blood counts, and that can range all the way to the care of patients who have blood cancers. I've been involved in different types of clinical trials. It might be studying the use of heparin in patients who have COVID, which is what we did earlier on in the pandemic. It might be, looking at a medication to minimize bleeding at the time of surgery. And over at Cancer Care, it might be looking at different ways that we can optimize supportive care strategies for patients who have MDS and leukemia. My long-term vision would be to increase infrastructure so that we can provide access to clinical trial access or research access to patients who are experiencing blood cancers and perhaps even just cancer in general, so that we can learn from our patients and we can figure out new treatments that work better, treatments that work more durably, that make people feel better, so that when people experience these types of illnesses, they can have better outcomes. Manitoba feels like a small community, and so to be able to reach patients who are in a vulnerable position and to provide them with care that hopefully provides them and their family members the support that they need during this time in their life is a real privilege. Through our research opportunities, we hope to provide better care to Manitobans, but also to expand beyond the Manitoba border as well, so that patients throughout Canada and eventually worldwide can learn from what we're doing here in Manitoba.